All right, joining us today, zooming in from Michigan, is Kristy Smith Burke. Kristy is a JU volleyball alum and someone who's very busy. So we really appreciate you getting up early and spending some time with us. So, Kristy, thanks for coming on the show.
Oh, thanks, Pat. This is great.
Yeah, no problem. Like I said, JU volleyball alum. I think we had some overlapping years. It's kind of a trend now where we're seeing this happen. If you get either mentioned a few times or recommended on the show, you pretty much punch your ticket to come on. So Boz said that we had to bring you on. So here you are. So again, thanks for taking the time. And I guess first, let me just let you, kind of introduce yourself, and then we'll get into a little bit about past and what you're doing now.
All right. Well, I'm Kristy Smith Burke, JU volleyball alumni. I'm very proud of that. Thank you for the, being thrown into this, Carrie Bosworth. Hope my interview is as exciting as yours was. Right now, I'm a practicing emergency physician as well as primary care sports medicine physician in Detroit. I work for the Detroit Medical Center. And so this past year has been interesting to say the least. With the coronavirus pandemic, Detroit unfortunately was hit very, very early and very, very hard. And unfortunately, now we're seeing another fourth wave of patients with coronavirus. And so that's definitely changed my practice and changed everybody's life, this past year. So it's definitely been interesting. College days at JU were a lot easier, let's just say, than this past year has been.
That's probably a pretty big understatement. So, and when Carrie had mentioned you, and she had really said that you were front lines with coronavirus. So let's, if you can, just talk a little bit about that, because I know you actually have, I guess, dual roles at the hospital where you're doing really two different things. So if you can talk about, your two responsibilities there, and let's just get into, some of what you've seen, because we had Alex Ricker Gilbert on, who's the athletic director here, talking about how they had to manage, the student athletes and, dealing with schedule changes and all that. But I'd love to hear from someone that's really on the front lines. We also had Rachel Hannon, who's a nurse that's been dealing with some of the technology to help. So I'd love to just hear, again, the two sides of what you're doing, and just talk about the pandemic from your seat.
The pandemic from my seat. Okay. So I'm a practicing emergency physician. That's what I did my residency training in after medical school. And then which was 3 years. And then I did an additional year of training in primary care sports medicine, which was another year. And then I joined the practice at the Detroit Medical Center. And I've been working for the Detroit Medical Center, the sports medicine and orthopedics group, where I see clinical patients with all sorts of bone and joint problems. So from young athletes to 90-plus-year-olds, individuals who just have bone and joint pain and just want to go about their lives. The other part of that is I'm a practicing emergency physician at the Detroit Medical Center at Sinai Grace Hospital on the northwest side of Detroit. And very early last year, after I was about a month and a half come back from maternity leave, is when the pandemic happened. Yeah, we had our daughter, Elizabeth, in October of 2019. And so I was on maternity leave till February. So I was back to work about a month, when we first started seeing, maybe more than a month, we first started seeing our coronavirus patients that were just so ill with oxygen levels, and talking to me, oxygen levels that I'd never seen before. That it was terrifying, and they just kept coming. The sicker, it seemed like every patient was just sicker. Um, the way the emergency department works is there are levels of triage. So from the sickest patients to the patients that have very minor problems, maybe they need like stitches removed or something like that. So the sickest patients are called medical resuscitations. And in our emergency department, we have 4 large resuscitation rooms and 1 for pediatric patients. And there's a siren that goes off in the emergency department. We call it the tweeter. And the tweeter goes off, and we rotate group. Each physician rotates. It's your turn to take the sickest patient that comes either through the front door of the emergency department or comes in by ambulance. And there were several shifts in March and April when it just seemed like every 10 minutes, the tweeter kept going off. And it was the same thing: difficulty breathing, shortness of breath, difficulty breathing, cardiac arrest, where somebody had stopped breathing and their heart had stopped beating. And they all had these unbelievably low oxygen levels. So normally people live their lives between, 95 to 100%. These people were in the 40s and 50s and were talking to us. So it was definitely, it was terrifying from my standpoint. I was a brand new mom and here I am in a pandemic, and we knew how this was transmitted and the easiest way possible, through the air, and here I was taking care of patients that couldn't breathe. And so I had to help them breathe. And one of the ways that we do that is by intubating the patient. So we put a breathing tube down into their lungs and we put them on a ventilator, which is the most dangerous procedure that you can do, which exposes you to respiratory particles as they're breathing. So I luckily have the most fantastic partners in the world, and nurses, respiratory therapists. I mean, our team at Sign of Grace is unbelievable. It's just the best group I could ever imagine working for. I feel very fortunate to be a member of that group. And so it definitely was a team mentality, which for me was, definitely something that made me feel comfortable, having played volleyball since I was in fifth grade. Always had been involved in a team all through high school, all through college. I even had a volleyball team when I was in medical school. And so team has always been a big part of my life. And so that part of it was definitely something that, helped in those days during the pandemic, having my partners, my teammates, nurses, respiratory therapists, our nursing assistants, paramedics, everybody, all hands on deck, working in the emergency department for our patients. And so it definitely, to say it was the worst shifts of my life that I've ever worked, that's an understatement. And so, because there just were so many patients and there was only so much that you could do for them. And between the patients that I lost in the emergency department and then getting phone calls from family members of my clinic patients saying that my clinic patients who I've been seeing for 7 years for knee pain or shoulder pain, and I've been taking care of them, had passed away from the pandemic, when those numbers started climbing over weeks, my other partners in my practice were just like, it was just almost, it was unreal at first.
That's truly incredible. And thank you for all you're doing. I mean, you hear so many varying stories, and obviously people have their opinions on what should or shouldn't be happening. And so that's why I was actually really excited to talk to you, because you watch one news station or read one article, and it's just, people are so polarized on, should you vaccinate, should you wear a mask, should you, so all the things, right? Um, so let me ask this: when it first hit, because coming back, I remember they were talking about the frontline workers, and maybe it was a few months, but they were saying that y'all were actually, they were testing the bottoms of your shoes, and you were even, bringing it on the bottoms of your shoes. So it went from like airborne to it could be on your shoes. I remember like there was just this escalation that seemed to keep happening with the protocols and the safety measures and all that. I mean, how early on did you all have to just completely, the masks and the gloves and like all this stuff that probably, would happen in like extreme cases, but it seemed like pretty much anyone in that setting was the big old shields and all that stuff. So how early did that happen for you?
Oh, my emergency department, our leaders, our administrators were right there with our infectious disease experts for the hospital, and they were writing the PPE, which everybody knows what that is now, the personal protection equipment guidelines. And so we started wearing the N95 respirators and face shields and goggles, and I've always worn scrubs, and then gowns, gloves, obviously. We started wearing those really early. Which, I'm thankful to this day. I've been tested numerous times for antibodies, numerous times for the coronavirus, and luckily I never have become positive. And I never had positive antibodies. Hopefully I do now, since I had my first vaccine in December. And then the second one, the Pfizer vaccine, I had the first one in December and then the second one in January.
Okay.
But prior to that, no. And I mean, I was doing the riskiest procedures. And so I did have some faith in wearing my PPE correctly was really important. And so, yep. So we were 100% PPE all the time. And so I wore it, I put it on in my car. I walked into the hospital with it on. And then I only took it off when I left the hospital and was physically outside. So our 9 to 10 hour shifts, I never took it off in the beginning. I didn't eat, I didn't drink. because that's a very dangerous part in what's called donning, is putting stuff on, and then doffing is taking it off.
Gotcha.
And taking it off, the more you take it off, the more you put it on, the more you potentially could expose yourself. So in the beginning, when, like you said, the news was all over the place because this is a novel virus. And so this was a moving research target. We were learning new things about it every day. So the basically what I adopted was err on the side of caution, or out of an abundance of caution. Those were words that I think were said, I don't know, millions of times as things were getting canceled at the beginning of the pandemic. So out of an abundance of caution, my routine was to, have everything on when I went in clinic or into the emergency department. I didn't take anything off. I changed at the hospital and showered at the hospital before I left. And then when I came home, everything stayed in the garage and went directly into the washing machine. And then I went and took a shower before I touched any surfaces in the house or any of my family members. And so, yes, so wearing the PPE started very, very early. I actually have a picture of what we look like. I mean, everybody's seen this on the news. Pretty much everybody looks just about the same. But yeah, so there's very little of us emergency physicians that you see these days. So
There you go.
that's about what you see of me these days. And so, so I have an N95, and then I have a surgical mask over that. And then I have goggles, and then I have the face shields, and then a surgical gown if I'm going to be going in the room, with the patient, and then, gloves. And then I do wear shoe covers. So
I don't blame you. I don't. I mean, it looks like something out of a movie. Like when you see when they, like war-torn country and they're, dealing with something crazy, like that's the kind of stuff that you see. And to see, just frontline workers on a daily basis having to do that, it's incredible. My brother-in-law and sister-in-law, they were pregnant during the whole pandemic. They just had their child a few months ago. And, I know that they, talk about like an atypical situation of, not seeing anyone during pregnancy. And now that the baby's here, like I've not even held her, my niece. And so I've got to imagine for you to be a new mom, going back to work, this happening, and, just to be coming home and have that worry. I mean, how did you and your coworkers, what kind of support have you received, or do you just have from your fellow coworkers, just on the mental side of things? Because there's obviously the medical side of it, but then from just burnout and worry and all that, I mean, that's got to be a whole other thing.
The burnout and the mental health crisis that's striking healthcare workers, is striking everyone in the world, that's dealing with the pandemic, is huge. I'm very blessed with, I really got lucky. I married my best friend. So my husband, he is in business. He's not in medicine. He's been working from home since the beginning of the pandemic. And I couldn't ask for a better sounding board, advocate, cheerleader, keep me straight, tell me when I'm outside the circle of sanity, to come back in. And then I have two younger sisters. My younger sister, Lauren, is a nurse at the University of Michigan. And then my second sister, Ashley, is a physician's assistant at Providence Hospital here in Michigan. And she works in the emergency department. So Ashley was working shifts pretty much, we weren't alongside each other, but we were there at the same time.
Okay.
And my sister Lauren was working at the same time with her cardiac rehab patients, and she actually was pregnant. She had her daughter last April. So it was a very unique experience, and I don't know what I would have done without them. From the mental health side of things, we were constantly checking on each other, sending pictures of our faces with our lines, in our masks, and all of our skin changes that hadn't happened since we were in high school and we're teenagers. But then also my practice has been wonderful. I mean, we are affiliated with Wayne State University here in Detroit, and the Department of Psychiatry has numerous resources. There was Zoom counseling meetings with psychologists, psychiatrists. So we've always had that available. Obviously in the beginning we didn't, because we were just trying to figure out how to make it through day-to-day operations. But then as we saw that this was something that wasn't going to be going away quickly, and that this was going to put substantial stress, on the providers, that we needed an outlet to talk about what we had seen, because it's not really something that you want to talk about around the dinner table with your family.
Right. Yeah.
So it's good. it's good to have that professional outlet because, like I said, we had a new baby. My sister had a new baby. I wasn't able to hold my niece for till months later, till I had a 2-week quarantine period and hadn't worked, and then finally got to hold her for 2 minutes with a mask on, and I was like, okay, that's enough, that's enough. I was like, just being nervous myself,
Yeah.
but having that professional outlet. And so we have regular basis wellness meetings, which some can be anonymous, some are over Zoom, they can be in group discussions. I personally have talked several times with a counselor myself, for my mental health, to
Sure.
make sure that I'm putting that as a priority. And then, being a sports doctor, I prescribe exercise. And so, when things were getting really, really stressful, my husband said, when is the last time you worked out? He's like, when's the last time you exercised? And I'm like, that's a really, I'm watching way too much Netflix. And so, and plus it was, March and April aren't the best months of the year in Michigan. It can be really cold. It snowed yesterday. So, it can rain. So, I mean, as far as outdoor activities, sometimes we're blessed with a string of 70-degree weather, and sometimes it's 30 and snowing and cold, and it's gray and you don't see the sun. So that doesn't help matters. So, but yeah, so the exercise part of it, going for walks with my daughter. I mean, I never knew there were so many kids in our neighborhood because everybody was outside playing in the yard, the minute the weather has been nice, because nobody's going to playgrounds, nobody was in school, so we got to know some of our neighbors.
Sure.
And, thankfully did a lot of, my husband called it the summer of perpetual camping, because we were always bringing lawn chairs and, baby tents so the baby didn't get sunburned, and blankets so that we could sit under trees in each other's yards. So, so we did try to make the best of it, for a mental health, and not just be holed up here, in our house. But yeah, those were the things that, that we did together. And I mean, it definitely brought us closer together as a family unit. And I know a lot of my other colleagues in medicine, that was really what they held on to. But it also was scary at the same time. You're working and you're coming home, and are you going to get your family sick?
Right.
And so I'm very thankful now that my husband's vaccinated, and my inner circle of family members, it was the right decision for us. And so that's what we did to protect ourselves, protect our family, and protect our community.
Wow. Well, you've mentioned teamwork, you've mentioned support, you've mentioned exercise. So let's talk a little volleyball. I'm always interested to know, how our guests found the university, ended up making the decision to go to JU. So why don't you give me a little bit of that journey?
Well, I was a transfer, actually. I transferred in for my junior year. I started at the University of Alabama at Birmingham, and the things changed, and it wasn't the right position for me anymore. And so I had went back and looked at who had sent me information when I was in high school, and my dad helped me make a highlight tape, and we sent them off. And Robin Minery was the coach at the time, and she reached out to me, and I came to visit. And one of the team members at the time, Brooke Aaron's, now her maiden or her married name is Roach. She actually came to visit at UAB when I was there. And when I was at my visit at JU, I'm like, gosh, you look so familiar. I'm like, how do I know you? And then it turns out it was a recruiting trip that she had been on. And I think I was at JU 15 minutes, and I already had made up my decision that it didn't matter who else was recruiting me. That's where I was going to go.
Wow.
I loved the team. I loved the university. I loved the small feel of it. I fell in love with Florida immediately. I'd always vacationed in Marco Island. My family has some condos there that my grandparents have had since the 60s.
Okay.
So I'd made lots of trips down to, South Florida on the Gulf side, but I really just, it was just one of those things, like they say, when you know, and this was it. And by the end of the recruiting trip, they said, do you want to come here? And I said, yes, I do. And so I remember I called my dad from the airport, and I was like, so they offered me and I'm going to sign. He goes, well, what about X, Y, and Z school that are still talking to you? I was like, no. I was like, it's not right. I was like, this is right. And it ended up being the best choice, one of the best choices I've ever made in my life. Education wise, volleyball wise, friendship wise. So it definitely was the place that I was meant to grow up.
That's awesome. Yeah, it seems like a very common recurring theme. When I ask that question, there's a lot of that I just knew right away. It seems like when people get there, they meet, whatever program they were part of, when they meet the people, when they meet the coach, when they get that feel, there's just something about JU where if you're meant to be there, it kind of hits you quickly. And so it's cool to hear that recurring in the answers. I guess we had someone who said it was terrible, we wouldn't have them on the show. So the worst decision I ever made. Great.
Right, exactly. Yeah. No, yeah, it definitely, I had my thoughts about what I wanted to do, career wise. And then when I got to JU, I had one particular professor, Dr. Thomas Russo from organic chemistry. And he's just like, why don't you want to go to medical school? And I was like, I'm not smart enough to go to medical school. And he's just like, okay. He's like, we'll talk. And he convinced me. And so he convinced me that I was, and I'm like, you know what? I'm like, I think this would be I knew I wanted to do something with sports medicine. I had always thought that would be great. Physical therapy, athletic training, something along those lines. Maybe even coaching. I had thought maybe at one point if, the right job landed in my lap, and then things just kind of progressed. And unfortunately at JU, I ended up having 2 knee surgeries, and the knee surgeon I saw was at the University of Florida. And the first time I went to see him, he's like, I can fix this. And he said, and you can play your senior year. He's like, but you have to do exactly what I tell you to do. And I said, okay. And he's like, what's your parents' phone number? And I gave him my parents' phone number, and he sat in the room and he explained the surgery that I was going to have. And he said, if she does what she's supposed to do, he's like, she'll play her senior year. He's like, if she doesn't, she won't. And he was very frank, and he was very upfront, but he was also very positive, enthusiastic, and supportive of me. And so, and it worked out. And thankfully he was an excellent surgeon, and my rehab went really well. And so I was able to play my senior year. But that definitely, between all that, it turned me on to, sports medicine. And I'm like, I can do this for other athletes. And it definitely gives me an avenue when I have to tell one of my athletes that they are injured, that we do have to take them out of participation, whether it's a surgical case or a non-surgical case. And in cases, I've rolled my pant leg up and said, you're worried about scars. I was like, okay, this was surgery from 2002. This is what it looks like now. And so they're kind of, especially young women, their eyes will get really big. They're like, oh, you had knee surgery? I was like, yeah, I have matching scars on both sides. I said, if you want to see what they look like. So, and then actually talking with my partners in sports medicine, I have one partner, she played basketball, Dr. Britta Anderson at Wayne State University. And so having that rapport with your patients, that you're just like, I understand what you're going through, from, a very, it's not like, oh, I understand. A lot of people will say that, like, I can relate, but you can actually say, no, I actually sat there across from the doctor and they told me, you have this problem, you need surgery, and you're going to miss this part of your season or this part of your training. So I have been on the other end of that. And I think it's definitely served me very well in my practice.
Yeah, I mean, to be able to empathize with your patients and like you said, show them that scars are cool, and let's get you back out there. But and that is, I think that's an important thing, for someone to say, yes, I understand what you're going through, but not really understanding. Like, yes, I understand from an intellectual. I've read about this, I've studied, and I've helped a ton of people. But for you to say, I've been in your shoes and it's full circle, I think that's very important. So I'm sure that's very, very helpful, not only for you to be able to work with them, but for your patients to go, okay, I've got some confidence in what she's saying.
And then just, treating volleyball players. And so it just, I get a big smile on my face, not that they can really see it all that much these days with all of my PPE on. And so, but and I'd say, oh, like, are you an outside hitter? Are you middle hitter? Are you an opposite? What club team do you play for? Those kinds of things. And, oh, it probably hurts when you do this. And they're just like, oh, you know what that is. And so, that definitely brings you to another level, of understanding, with your patients. And so, and volleyball was the first sport I ever loved, and it still is. And I miss my teammates terribly. And so playing volleyball is still enjoyable, but it's not like it was in college. That was, I mean, other than the fact that, like, that level of fitness, I don't think I'll ever achieve again in my life. So, but the pace, the speed, and actually it's just the teammates. And so I miss them so much. Every time I play, I have little memories of our time together and the few big wins that we had, and friendships that I still keep in touch with. So
well, you've mentioned a few of them. So I want to end with a pretty common question, but I love just hearing the favorite memory, the one thing that really stands out for you for your 2 years there. What was, the one thing on the court or maybe just around the team that sticks out to you as kind of that defining story or moment from your time at JU?
beating the University of Central Florida at the end of the regular season when I was a senior. And so they had kicked our butts, and it was personal. So it was, and several of my parents actually drove to Orlando from Michigan and surprised me. One of my teammates was like, "Yeah, your parents, I just saw them up on the concourse." I was like, "What?" Because I'm like, "Is this it?" I'm like, "Is this the last game?" Like, I'm like, I was lucky to play as long as I did. I had, last high school game, last club game. I'm like, but is this really it? It was like, I was not a professional volleyball player candidate. I was very grateful to have played at the level I played, collegiately. But yeah, that and then serving as team captain when I was a senior. The fact that my teammates trusted me enough and that our coach trusted me enough. And so that was probably one of the most ultimate honors that I've had in my athletic career.
That's a great answer. Yeah, we've had a lot of people mention, that last game, that last out. Like I just told the story with Rachel Hannon about my last out. Like it was the end of the season. We knew we weren't going to the tournament that year, and so that was it. And it was it's something that sticks out, and I remember like yesterday. But yeah, it's just one of those things that will kind of stick with you forever. So
yeah, you can close your eyes and you can see I can see the arena. I can see it from side to side, and I can see it from where I was standing on the right side of the court when we beat them. And to me, that was great. And I have it on video. I have my dad put it on a DVD for me. But yeah, and so Boz wasn't there for that one. Carrie Bosler, she'd already graduated, and so but Brooke Aarons, Alicia Rodriguez, well, Chapman is her married name now, and so Withrow is her maiden name. And then yeah, they were my senior teammates, those three ladies, and we've kept in touch. We've been in each other's weddings, and so it's been those are definitely three very special ladies, along with Carrie, that I had the chance of getting to know and still being friends with, and thankful for social media because we live all in different places. That helps us keep in touch with each other a little bit.
there you go. Well, Chrissy, again, thank you so much for your time. It's been an incredible conversation, just catching up with you, hearing about your time at the university, and certainly what's going on today and everything you've done. So thank you for your service as a frontline worker. Thank you for coming on the show. Really appreciate your time today.
Thanks, Pat. This was great.